You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello, I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. I am a dentist with my own dental practice and I have been working holistically for over 20 years and I've been a dentist since 1992. In that time, the way I have viewed the way I work, what I've been taught as a dentist, my understanding of dental health and well-being has changed greatly. As a traditionally trained dentist, we're taught to use fluoride to prevent tooth decay, to fill teeth with metals, particularly a product called dental amalgam, and that these products are beneficial to our patients and have no impact on their overall health and well-being. But through my education and my studies and through my own realizations, I've come to see that that isn't always the case. And so here in the Dental Zone, these are the subjects that we talk about to help you to have a healthy mouth and a healthy smile for life, and also to be healthy throughout your life. So let's get to it. Let's get in the zone. And if you want to know more, you can hop on over to holisticdentistry.au. If you've been tuning in regularly, you'll know I've been doing a series on dental amalgam and the safe removal of them. So tonight I'm going to carry on with that theme. I'm going to talk a little bit more about mercury vapour and what we can do in the dental practice to protect you and our team, including myself, from mercury exposure. So why are we so concerned about amalgam fillings? Surely dentistry wouldn't use them if they weren't safe. Well, the issue is they were invented over 150 odd years ago. They've never been tested for safety. There's research that shows that they're safe, or they only release a small amount of mercury vapour, which the dental profession will admit. And then there are studies showing how much mercury comes out and looking at it as an accumulative event, not a one-off. So I'm going to start talking a little bit about mercury. So mercury is a heavy metal. It's as dangerous to us as human beings as lead and arsenic. Yet, as dentists, we're trained, as I said, that it's perfectly safe. You mix it up and you squish it up with the silver and the copper and the tin and the zinc and the other bits that make an amalgam filling, and somehow this mercury is safe. These fillings actually contain 50% mercury. And so there have been many studies that actually show that the mercury evaporates as a vapour off the filling anytime there's heat or friction applied to the teeth with the fillings in. So you can just imagine that every time you eat, you have a hot meal, a hot drink, brushing your teeth, clenching and grinding, even swallowing brings your teeth into contact and can vaporise mercury. That mercury is coming out of your filling as an invisible gas that you can't see, you can't taste, and you can't smell it. And this is a vapour or a gas that you're breathing in. And that mercury gets breathed into your lungs, it transfers out into your blood, and from there it goes into the cells. So mercury is able to enter any cell in the body. It will even cross the blood-brain barrier that's supposed to keep nasties out. It will attach to the nerve tissue, to the pituitary gland that controls your hormones. It will cause your brain cells to shrink and become damaged. Now, studies show that mercury is released from the amalgam fillings and it appears in the kidneys, the brain, the thyroid, and even the lining of your intestine, just to name a few. And these studies were done on sheep using radioactive mercury mixed into amalgam fillings, and then they were able to track where it goes in the body. So if you ask most dentists, should I be concerned about my amalgam fillings, they're going to say, no, they're completely safe, leave them alone, don't touch them. Or they may replace them for you thinking you're wanting it done for cosmetic reasons, and that can actually be more detrimental than being told leave them alone. So the reason why we're told they're safe is because the amounts of mercury coming off the filling on a daily basis seem quite low. But a filling just as small as, 2 millimeters by 2 millimeters across, that's pretty tiny, will release around 15 micrograms of mercury a day through wear and tear and mercury evaporation. Now, think about this. The average person is going to have about 8 fillings a day, and they could be absorbing 120 micrograms of mercury a day. Well, so what? Those figures don't really mean anything when I'm just throwing them out. 15 micrograms, 120. What does that mean? Well, if you compare that to the daily uptake of mercury that we get from fish and seafood and our environmental exposure, that's averaging about 2.5 micrograms a day. So if you've got 8 fillings, you are 60 times over that. And I consider that to be very significant. Also, it's what you're being exposed to in one day. Now, that mercury vapor is coming out of your filling every day for the lifetime of the filling. So you think about it, these fillings were designed to be hard wearing and long lasting, and look, that's what we want from a filling material. But that means they're there 20, 30, 40 years, constantly gassing out mercury into your system, which is then accumulating in your body. So let's think about this. So that's what's happening on a daily basis. What happens when the dentist puts their drill on that filling? Now, those drills go round so fast, they create an immense amount of friction on the filling, even with us using cold air and cold water to try and keep it cool. You are still getting a tremendous amount of friction, and that increases a massive amount of mercury vapor release. So while that filling's been worked on, you've got mercury coming off, in huge quantities, which you're breathing in. It's landing on your clothes and skin. The dentist and their team are also breathing it in. Now, add to that when you're drilling, the filling doesn't come out in one nice clean lump. No, it gets broken up, and there's dust and there's particles and there's bits going everywhere. And that all ends up inside your mouth, splattering into your cheeks and tongue. You're going to swallow it, you're going to breathe it in. Now, you've got to ask, how good is that for you? What's that doing to your health in the process? Now, that's your health on a one-off exposure. Let's think about the dental team. They've been told it's safe. They've been told when they drill it, the suction that they use captures the mercury and everything's fine. We're told not to worry about it. But that dentist is breathing the mercury in day after day, patient after patient. Their team's being exposed, and anyone else who's in the room while that's happening is also getting exposed to mercury. And to me, that is wrong. You can't take young, I was 18 when I started dental school. You're taking young kids and teaching them that what they're doing is safe when they are being occupationally exposed to something that is so detrimental to their health. I'm going to get on a little bit of a rant. So with mercury, you go, well, so what? If it goes in my body can detox. Well, to a certain extent it can, and some people are quite good at detoxing heavy metals. However, we live in a society, in a world now where we're highly stressed, our diets are quite poor, and even if you're eating what's called a good diet, it can be lacking nutritionally. So your body is becoming more toxic, and it finds it harder to get rid of mercury, and so it starts to accumulate in the cells and structures. Then there are people who actually can't excrete mercury because they've got genetic mutations, and they are super sensitive to this stuff and will just be absorbing it. Then they present with health conditions that nobody really understands why they've got them, and it's mercury toxicity. And by dealing with that, they can improve their health. And that's one of the reasons we remove mercury fillings. So I've told you this mercury vapor comes off. So what do we do about it? How can we prevent you, our patient, our team, and ourselves from breathing that in? Well, we've got some little tricks and tools up our sleeve. So we have a machine called Jumbo. Now, Jumbo is the IQ Air Dental Pro HG, which if I tell you he's called that, that's a bit of a mouthful, and you're kind of like, oh, that sounds a bit scary. And, I know people don't like coming to the dentist anyway. So we call him Jumbo because he's got this big trunk, and Jumbo sucks. No, literally he does. I'm not bagging him out, but that's his job. The IQ Air Dental Pro HG is an air suction and filtration device. It's been specifically designed for use in dental practices so it can capture mercury vapour. So even when drilling those amalgams, like I said, even with lots of cool air, water spray and the dental suction, not all the mercury vapour is going to be collected. It escapes into the room. Now, I don't know about you, but being a holistic dentist and handling many amalgams on a daily basis in my Brisbane clinic, I don't relish the thought of exposing anybody to mercury and having them breathing in this toxic substance. And I don't want to be doing that. And I actually don't think my dentist colleagues should be doing that for a living either. It's like sitting in a room with everybody smoking when we know how bad it is for us. Yep, I know we choose to do that because we think smoking's nice and etc. But that's a different story, so let's not go off track, otherwise I'll be here all night. So what we've done is we use oxygen masks connected to a tank of sterile air. So there's a little nose piece for you, the patient. The dentist can wear one like this, or if we don't use an oxygen mask, we use a respirator mask that's got filters specifically for mercury. We do find these a bit cumbersome, they're claustrophobic, certainly for the patients having everything over their face, and it does make it hard to communicate, and sometimes it makes it hard to see what we're doing because you've got these big things sitting on your face. So along came these clever people from Switzerland, from the IQ Air company, and voila, Jumbo was born, and a lot of our problems were solved because we knew even with all our safety protocol, there was still mercury going up in the room and landing on clothes and skin and polluting the environment. So the Dental HQ Vac Pro, they're designed to improve air quality in the dental surgeries, and as our workplace exposes dentists and the team to a wide variety of pollutants during our routine dental work, we use them a lot because they'll capture bacteria and viruses and grotty particles that are coming off while we're drilling, because that's part of our commitment to your dental care here at Evolve. So Jumbo has this big suction trunk that we position close to your chin while we're working. Now that trunk allows the machine to suck up the vapour that's released, any aerosols that the suction doesn't catch, and it will mop them up. The mercury vapour is going to be collected in all these banks of filters inside the body of the machine, and it's designed to capture mercury and not just nasties like bacteria. So by using Jumbo and all our SMART safety protocols, SMART stands for Safe Mercury Amalgam Removal Technique, we're one of only a handful of practices here in Australia who is certified to use the SMART technique. And, we're just very confident through that we are greatly reducing your exposure to mercury, and we're also looking after our own health. So actually the process of looking after the mercury vapour is very simple and effective, and it's quite fantastic now that we've got Jumbo, and I say he's worth his weight in bananas, to be quite honest. So look, if you're concerned about your dental health, mercury, amalgam fillings, then make sure that you contact a holistic dentist to find out more and to get them removed safely, or head on over to holisticdentistry.au where you can read more about it, or you can listen to more of the Dental Zone podcasts. If you're in the Brisbane area or you're willing to travel, then you can come in and have a consultation with me. Our number is 0737 20 1811. And I look forward to supporting you with your amalgam removal process. I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. This is the Dental Zone podcast. Thank you so much for joining me. I really appreciate you taking the time to listen. For all things health, well-being and dental related, this is really the place to be. So until next time, stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness and a great smile, get in the zone.